NORD gratefully acknowledges the Martin Mueller for Achalasia Awareness Foundation and Eric S. Humness, MD, Associate Professor of Surgery, S. David Stolberg Research Professor, Northwestern Medicine and Feinberg School of Medicine, for assistance in the preparation of this report. Cardiospasm. Dyssynergia esophagus. Esophageal aperistalsis. Megaesophagus. Achalasia is a rare disorder of the esophagus, the tube that carries food from the throat to the stomach. It is characterized by impaired ability to push food down toward the stomach, peristalsis, failure of the ring-shaped muscle at the bottom of the esophagus, the lower esophageal sphincter, LES, to relax. It is the contraction and relaxation of the sphincter that moves food through the tube. Most people with this disorder experience an impairment in the ability to swallow, dysphagia, as a major and early symptom. Dry eyes, keratoconjunctivitis sicca, and dry mouth, xerostomia, are not unusual in patients with achalasia. The aspiration of saliva and food contents by people with achalasia may cause pneumonia, other pulmonary infections, or even death. The incidence of esophageal cancer is significantly increased in patients with achalasia. The exact cause of achalasia is not known. Some clinical researchers suspect that the condition may be caused by the degeneration of a group of nerves located in the chest, Auerbach's plexus. It is believed that there may be a rare, inherited form of achalasia, but this is not yet well understood at this time. Achalasia is a rare disorder that typically affects adults between the ages of 25 and 60 years. However, this disorder may occur at any age, including during childhood. Achalasia affects males and females in equal numbers except in cases that appear to reflect an inherited form. In those cases, it appears that males are twice as likely as females to be diagnosed with this disorder. X-ray examination, radiology, is frequently useful in the diagnosis of achalasia. Radiological examination, especially with the use of barium, may show enlargement, dilation, of the esophagus and the retention of food and secretions within the esophagus. Devices that measure fluid pressure, manometers, within the esophagus are used to confirm the diagnosis of achalasia. Treatment. The treatment of achalasia is aimed at removing obstructions caused by the failure of the lower esophageal sphincter muscle to relax. The drug isosorbide, a long-acting nitrate, or nifedipine, a calcium channel blocker, may provide some relief for people with achalasia. Approximately 70% of cases of achalasia may be treated effectively by the enlargement of the lower esophageal sphincter muscle through a procedure known as pneumatic balloon dilation. Surgical treatments of achalasia may be effective in approximately 85 to 90% of cases. Information on current clinical trials is posted on the internet at www.clinicaltrials.gov. All studies receiving U.S. government funding, and some supported by private industry, are posted on this government website. For information about clinical trials being conducted at the National Institutes of Health, NIH, in Bethesda, Maryland, contact the NIH Patient Recruitment Office, toll-free, 800-411-1222 TTY, 866-411-1010 email. For information about clinical trials sponsored by private sources, contact www.centerwatch.com. For information about clinical trials conducted in Europe, contact https://www.clinicaltrialsregister.eu. Achalasia Awareness Organization USA. Email, website, http://achalasiaawareness.org. Martin Mueller for Achalasia Awareness Foundation Incorporated, 111, Hampton Meadows Drive, Bonaire, Georgia, 30105. Phone, 478-302-8827. Email, website, https://www.achalasiainfo.com. Core 3, St. Andrew's Place, London, NW1, 4LB, United Kingdom. Phone, 207-486-0341. Email, website, http://www.corecharity.org.uk. Genetic and Rare Diseases, GERD, Information Center, P.O. Box 8126. Gaithersburg, Maryland 208988126. Phone 301-251-4925. Toll free 888-205-2311. Website http://rarediseases.info.nih.gov GERD.